everybody. Hope everyone's having a happy Thursday morning and enjoying the fact that we are above 0 degrees here in York County, Nebraska. I want to welcome you to our York County Community Sector Briefing on February 18th, 2021. And I would like to start by introducing Laura McDougall, our Executive Director with Four Corners Health Department, for her update.
Thank you, Lisa. It's good to see everyone this morning. I have good news on the case counts and things for the past couple weeks. We are definitely still kind of slowly declining as we have cases coming in. They're just slowly decreasing, so that's great. That's the best case scenario, so that's really good. And again, you know, I think I would want to just thank everybody for all you're doing to help slow the spread of this. We have you know, there's so many people that are really doing those, practicing those good public health interventions, that social distancing and wearing masks and avoiding crowds, and that is really brought us out of that terrible peak that we had in November. So thank you everyone for all you're doing, and you know, you can we should all pat ourselves on the back that our case numbers are continuing to decline. That's just very good. So with that being said, just to give a few numbers, in the last 14 days, York County has had 48 cases, and in the last 7 days, we've had 18 cases. So you can see that we're steadily declining, and boy, that's a refreshing number to see compared to where we've been. Our star though in our district is Butler County. They only had 1 case in the past 7 days, so they've really been doing great there, and you know, we can hope we move in that direction still in York County. So for all of the district, we have only had 65 cases in the past 7 days. So you know, we are still having some community transmission. We still have some clusters out there of COVID, but it's definitely getting better. We are, and I know that the hospital sector will talk a little bit about testing and things, but we, you know, across the district, we really haven't had as much testing going on either, but that's because we don't have as many people who are sick. We are seeing a little bit of influenza pop up in getting reports of a little bit of influenza B that is very sporadic, but we pretty much, we aren't seeing much flu either. Just a little bit, just a few cases of influenza B at this point. So, you know, all these interventions that we're practicing are also helping with the flu right now, keeping that under wraps. I want to talk, I think that what everyone wants to talk about, vaccines. I want to give you all a vaccine update. The last couple weeks, we have received 800 doses per week of vaccine for our district. And so we are still working with the same partners that we were before to spread that vaccine out and get that vaccine into arms. What we've been doing is that Four Corners has we have kept 10% of that supply to work on critical infrastructure, which includes the first responders, utilities, homeless shelters. We also did had to make sure correction staff was taken care of. So with 10% of the supply, that's what we've been working on, and then 90% of the supply goes to the medical facilities to give shots to people who are 65 and older. And what we have been doing has been working from oldest to youngest in that group. And so our medical partners will give us an update too on where they're at on that. But They have been steadily whittling away at the 65 plus group, and that has been going well. I think across the district, what we're hearing is that we have in those age groups, we have reached the mid 70s in most of our counties. That's where we've been making appointments with those groups. So that's kind of where we're at right now. We're working towards the 65-year-olds. And but for the most part, we've still been vaccinating in the mid to upper 70s at this point. And even some 80-year-olds and 90-year-olds are still coming in for their vaccines. So that's kind of where we're at. We have, with Four Corners, looking at where we're at with the critical infrastructure, we're finishing up the utilities and the first responders. So we are very close to starting schools. And I will give a caveat to this at the end of my talk here, that we've had some developments with that. We also have 4 National Guard soldiers that have been deployed to us to help our district in getting vaccines out. So if you're at one of our clinics and you see one of them, they are here and they're staying in a local hotel so that they can help us. They've left their regular jobs and they're here with us now, helping us to get vaccine out. So you can thank them for their service, and they are just, it's been wonderful having them here. We've been able to get a lot more done, and they've been helping all of our partners as well with their vaccine clinics. So it's wonderful having them here. Okay, so now I want to talk about sort of what the big news for us this week was. We've had weather challenges, which I don't think that's surprised anybody. I know we've all been dealing with those. We have received no vaccine this week. So we are expecting to get 800 doses. We were expecting to get 800 doses on Tuesday or Wednesday, and now we have learned we will not receive anything. So as a result of that, we have had to do some canceling of clinics this week. But we do have our clinic in York is proceeding, and I know Jim's on, he can talk about that, so that's good news. But I know on the Four Corners end, we've had to cancel some clinics, as well as then in other counties, we've had to do some canceling. So we will probably get a nice big shipment of vaccines sometime in the future. We don't know when they're going to be able to start distributing the vaccine again. They're having problems in the distribution chain. So please be patient with us. By the end of today, or by later today, we will have all of our vaccine in the district. We will be down to 0 vials. We're having yesterday there was a big vaccine event. They were giving lots and lots of vaccines over in Seward yesterday, and today we have our clinics in Butler, York, and Polk are taking place. And once those clinics wrap up, there will be 0 doses left in our district. So we have appointments set for all the vaccines left in the district at this point. And as soon as we get our next supplies, we'll probably get 2 weeks worth in 1 week. So we'll be going gangbusters again as soon as we do get some more vaccine. We also know that Walmart has been supplied with some vaccine and have been making appointments with people. So you may hear about that, as well as the VA has been also vaccinating some people. So those are also places giving vaccines. Walmart's working as part of the federal retail pharmacy program, giving vaccines, and they're doing, Walmart's doing that sort of through their own systems, and the VA as well is doing some of the veterans. So we know that that's also going on. Next week, we're expecting since we still haven't received this week's vaccine, but our next ability to order vaccine we will be receiving 100 less doses. So we'll be down to 700 doses for our district, which was a little bit disappointing for us, but we're going to just keep going and work through it. We're guessing right now that we're about one half done with our 65 plus group who are expecting to be vaccinating. We think that about one half of that 65 plus group has received their first dose, and about a quarter of that 65 plus group has received their second dose. That's kind of where we're at in estimating where we're at in the age groups. And of course, a lot of that age group probably that has been fully vaccinated is some of those people are in the long-term care facilities, assisted living facilities. We've been working on them for a while, but we are still making some progress in that age group. So with that, I think I know that we'll have some great updates from the medical sector. So I'm going to pass the baton back to you, Lisa.
Thank you very much, Laura. I'm not seeing any questions either on Facebook or on our chat here for you. At any time, if you guys have questions, feel free to type them in, or if we're at the end of a speaker, go ahead and ask. And now I would like to ask Jim Ulrich to come forward.
I am forward.
Thank you.
Thanks, Lisa. Yeah, good news on our front that we've seen in the hospital as well, and throughout the York General system. I usually start off with statewide hospitalizations. Their system was a little slow today, or the website was. I finally got the numbers for hospitalizations that go through the 16th of February, and they're up to 185. It's about 8 up actually from yesterday, which is 177, but still extremely low compared to the peak that was 987 back in November, on November 20th of 2020. So it's increased over 80% since then. 185 puts us back in that September timeframe before we really saw the beginning of the uptick of cases that end up with our peak in November then. But so we've made up all that difference again, and then some. As far as the testing, our testing numbers have been down, just like Laura mentioned, across the entire district. From the days of the 9th of February to the 15th, we had 28 individuals is all that we had tested, and 4 of those were positive. The week before, we were 43 with 7 positives. So all those numbers have been down from what they were, obviously, at a peak. And due to weather, yesterday we did cancel, along with a lot of players around the state, our Test Nebraska. And we only had 9 signed up, though, at the time. And I think around the district, we've seen a lot of that same sort of down in numbers. But we're still doing outpatient testing through our ER. And I do know that York Medical Clinic's also doing some testing, some COVID testing as well. So our patients in the hospital that have COVID through our ER over the 9th through the 15th that week, we treated only 2 COVID positive patients through our ER. One was admitted to our facility and one was transferred out. And so on the patient floor, we admitted 2, but one of them was discharged. And so we have 1, as of at least yesterday. Our morning brief's going on right now, so I can't tell you if we still have that patient this morning, but as of yesterday, we had 1 current, 1 COVID patient in-house. Because of our numbers have been down over the last few weeks, we have now opened back up our COVID hallway, which helps our overall hospital capacity quite a bit. And because we've had kind of a baby boom as well for us. And then we've had other sicknesses that have gone on through this whole time too. And so we've been pressing the envelope on our capacity. So this move will help quite a bit. And we do have negative pressure rooms, a couple of them, that we can still put the COVID patients in. And that's where the COVID patient is currently as well. So when switching gears then for the our other campuses of our facility, the hospital has moved to a green level of restrictions, which is lower restriction level overall, and those signs are posted in the cafeteria throughout our hospital too. You know, it's got a whole it's gradual loosening up of some of those restrictions. And if you would talk the clinic that's going on today for vaccines at Westview, we plan to administer, I think, Laura, you might have mentioned the number, 140 doses. That's, thank you very much, you know, for that allocation, because we're borrowing. And the thought was once we get our allocation between us and York Medical Clinic, and we'd pay back Four Corners, but we haven't seen that, obviously, like Laura said. So we're going to be administering all those. Everybody has an appointment for those 140, and there will we have appointments for the 75 plus age group. So that's exactly where Laura said. That's where York General's at. I do know there's some 80-year-olds that are out there that obviously they're 75 plus as well, so we'll catch them. And I won't belabor the weather issues that Laura talked about as well. Some other good news I really feel is that starting on the 25th of February, our Thursday vaccine clinics from that point on Thursdays are going to be held at the Holtis Convention Center. Because we got some big, provided we have the supplies, we have some big numbers that are going to start coming up. Because those 80-year-olds that we had vaccine, first dose vaccine are going to start rolling on to second doses, and on top of our weekly allotment as we start to chew away at the 65 plus age group. And so we're going to have some bigger clinics, and this is just going to provide much easier traffic flow, parking, space overall for check-ins, and socially distanced individuals that can be monitored for 15 minutes too after their vaccine. So I want to say thank you to the Holtis Center, Terry Carlson, and Barry, certainly the city of York, for coming through for the venue for us and working with us so quickly on that. Very much appreciated. So last Thursday, York General vaccinated 263 individuals, 204 first doses, 59 second doses. And so it was a decent sized clinic then last week too. So to finish up a little bit, our other campuses too, the Hearthstone continues to be all green. Haven't had a positive case from employees or residents for quite some time. And that's very good to see. I know the residents are more than 2 months that way. Been a little hard to hold outpatient or outside resident and family visits. Imagine that, you know, with the weather being 24 below recently and everything. So we're going to try to get back on track on those. Willowbrook's doing well. We've had their indoor visits that have been happening, and so those are really some good signs continuing there. And we only have one staff out of our 400 and somewhere around 85 or 90 employees. Only one staff that's out due to COVID exposure at this time. And again, that person could be rolling off any day on that. So looking forward to that day when we have none, and that's down from 4 last week. So any questions for me? If not, those are the extent of my comments today. Thank you.
Jim, I'm not seeing any questions either on Facebook or on the chat here on Zoom. So I would like to provide the update for Henderson Healthcare. They have started construction. It's underway, going good, and they are having a community health fair this week. I'm not sure. Let me double check my email here. Lisa just emailed me. She doesn't have a mic, which is why I do this for her. The community fair is running the 15th through the 19th. So tomorrow, today and tomorrow yet, from 7 a.m. to 9 a.m. for lab draws. So that is an option for you. I do remember Luke saying that it was a very economical way to get some of your lab draws. So remember, today and tomorrow, Henderson Healthcare is doing those. And so now we will move on to the local government sector. I don't believe Randy from York County had any updates, so we will kick off with Barry.
Good morning. A few things to talk about. I guess one thing that, has been kind of a hot issue over the last few months. The mask mandate for York is going to expire the end of the month. At this time, our intention, I guess, or in talking to the Board of Health and stuff is to let that expire. Of course, we know both sides of this, but we would hope that people would, and the message would be consistent with Laura's message that we have to keep doing all the things that we've been doing. So we're going to turn that back over to people's responsibility. I think people were doing a pretty good job before we did the mandate, and the mandate was necessary to help us, really curb some things that were going on in the community when we started that in November. So appreciate everyone's cooperation, and to my knowledge, we didn't write one ticket, so that was good. That there was. I know some people still didn't support it, but I think overall our numbers were better. Glad to see that a lot of our city essential workers have been getting their shots. These guys have had a pretty tough stretch out on the street and water department the last couple of weeks. There's been a lot of snow, and I know we've had 4 or 5 water breaks as warmer water hits cold, and and they've had some things go. So those guys have been working in some pretty tough conditions trying to keep things rolling. So just a thank you as always, but we haven't had a winter quite like this for a while. And so it does kind of strain some areas and put some people in some positions where they have some hard work to do. We have a council meeting tonight. It's a kind of a long agenda, but most of it will go reasonably quick, I think. One real great opportunity we have is the opportunity with these low rates to do some refinancing of some bonds. And we've got one that has to do with the ball field on tonight that's going to provide us some substantial savings over time. And then we're looking at a couple of more refinances at the next meeting that will get put together. So that's a positive of these low rates is that we can look at some of those and do some refinancing. We've got I was on a tour yesterday of the auditorium. A lot of the work is getting close. The timeline is probably to try and have that work over there wrapped up in the next 30 days. We have some events towards the end of March, so we're going to make sure that it's ready for that. But it's turned out well. We've had minimal change orders, somewhere between 3 and 4% of the $3.5 million bid on that. So, very pleased that we didn't have any other big surprises. There's always going to be a few things that with an 80-year-old building that's going to pop up, but really happy that we didn't have any big surprises. Right now, that process will have to just get it finished, cleaned up, and they have started over at the community center. The community center will close the end of the month, and will be closed, into the summer. And I don't know the exact date. We'll get it open as soon as we can, but the museum is completely emptied out right now as they've been trying to remove asbestos in there, and that process is going on. So all the things in the museum are out of there. So one of the discussions that, is going to happen tonight, and just, throwing it out to the community, is once that whole space is empty, what is the best future and thing for the community center and the museum. So we have a little time to talk about that. So we're going to throw that out there and let people kick that around a little bit. But that will, I know, be the community center will be missed by many over the next few months. And I keep telling Cherie that it's some short-term pain for some long-term gains. So that isn't fun to hear in the short term, but, saving that building and fixing the pool once and for all, where, the recirculation is supposed to be in 4 or 5 hours and ours is 16 to 20, so I mean, we're way beyond codes, and we're fixing a few other things, but big job. And also some, some fire marshal issues that are getting fixed, and lighting and heating and cooling over there. So just really fixing what is a 60-year-old building, and trying to, or 55, 60-year-old building, and trying to make it last for decades to come. So One other thing I would mention is that we are in the process. Our city administrator did announce his retirement at the end of last year, and we have been taking applications over the last period of time and have a number of those. And so we're in the process of trying to talk to some of these people personally and kind of narrow some things down. So that is going on, along with still looking at a couple of the open positions that we have. So we're moving along with that process, and we'll let you know as soon as we have anything. And other than that, I think that's all I have for today. So everybody enjoy the balmy weather of 25 degrees by tomorrow.
Hey, Barry, there is a question for you on chat asking if council meetings will be on Zoom or live on Facebook.
We don't have it set up live on Zoom for tonight. We don't have anything set. So if necessary, if that's something that we could try and look at going forward again. We have been able to kind of social distance people a little bit, and people have been wearing masks at the meeting. So we have welcomed people to come, but we haven't had anything with huge attendance here in the last few weeks. But we can sure look at that again.
Okay, thank you. And there's an answer that says yes, please.
Okay.
Okay, now there's a couple questions on Facebook for either Jim or Laura. I'm going to let you guys decide who takes this. The first one is, how many allergic reactions have there been to the vaccine and how has it been handled? And then the second question is, if one gets the first shot at Walmart, will they have the opportunity to get the second shot at Four Corners?
I can start. We have, and I see there's another comment I'll address too here in the chat. So in terms of the allergic reactions district-wide, we have not seen any yet. And unless Jim knows of any, I have not heard that we've had any allergic reactions across the entire district. We've had some people with side effects. Jim, have you heard of any allergic reactions?
We've had some side effects and have seen they vary quite a bit, first dose as well as second dose. But to my recollection, I think we only had one person that maybe had a reaction, and we were able to treat it very, very quickly, and take care of it. And like you said, an allergic reaction, Laura, but I haven't heard any since. And I think that was actually one of our employees probably, but it was handled very quickly, and it wasn't an issue.
One of the safeguards that's built into all of our clinics, if people do have an allergic reaction, we all have access to epinephrine, which is used to treat those allergic reactions. And there's always, groups on standby, especially this is one of the real perks with having a hospitals administer the vaccine too, is that a lot of the vaccines are being administered through the hospital. So medical personnel are available right there. But when we do go, we are planning to go to schools and things, and we have epinephrine on hand, and the nurses know how to give that if there's an allergic reaction. So we're prepared. And then the other remind me what the other question was, Lisa. I'm sort of I lose my track.
The next one is, if someone receives their first shot at Walmart, can they get the second shot at Four Corners or the hospital or another location?
So this, I'm not going to say never because we do have some snowbirds coming back that have maybe had one vaccine. And we do what we can to get them their second vaccine. But the way that the vaccine comes to us is that each vaccine, the first dose comes to us and the second dose comes to the same provider for that patient. So if you get your first dose, you really need to go back If you get it from Walmart, you need to go back to Walmart for the second dose. You get your first dose from someone in that's, say, York General or, you know, Henderson or Four Corners, you need to go back to the same provider and get that second dose, because they're the ones who receive the dose for you. And then I also have a question here. Health department or hospital need any volunteers? Yes, in fact, I am looking for some people who might be able to go help basically with some of the administrative stuff at some of our clinics. So if you have, if you know of anyone who's would like to go, that might be interested in doing some temporary work like that, it's pretty temporary. It'll be just for when we go out and do clinics. But I would appreciate, contact me at Four Corners. Yes, I'll put it in the chat. I'll put my phone number in the chat. Thank you.
Laura, you know, and I know that the Chamber of Commerce, Madonna, you've been on, and I think Rhonda, you may have done this too. I don't know who sent it out, but in working with us in our switch to the Holtis Center, I think we're reaching out to our chamber ambassadors first to see if they can help with some of the escorting from the parking lot kind of things as well. Because it's going to take a little bit more to do that, because it's going to be a specific area to go in, I believe, on the be the west end and come out the south, where your inclination would be to come in the south, but that's not how we want the traffic flow to go to separate people. So, so a little bit of help that we could have on that end would be appreciated in the weeks ahead. Thanks.
And then Lisa, if you need the volunteers in Henderson, if you just want to type in yes and your phone number for contact in the chat, I would appreciate that. Okay, I'm not seeing any other questions right now. I hope those answered some of the lingering questions, and continue to go ahead and type them in or ask. So we will move on. I'm not seeing any of the other communities that have a report they want to give right now. So we'll move on to the education sector. Mitch, are you still on?
Yeah, good morning, Lisa, and everybody else. Yeah, real quick, I'll share the good news. Our cases are low. Matter of fact, we'll drop our single positive case off today. So that's a good thing. So if nothing pops up today, we'll go to 0 tomorrow. And then as I was looking, as everybody else was talking, I was looking at our spreadsheet. We have 3 currently quarantined out of all staff and students. So those are tremendously low numbers. And as I talk to other schools, we're kind of hearing the same thing. So that's a great thing. You know, we continue to have our safety plan in place. There are a few things that I suppose we've relaxed a little. We feel like we can. And so that's, I think I mentioned a few weeks ago, you know, some of the fun of school has disappeared. And so we're trying to bring that back a little bit and so on. And again, we have safety plans in place that we feel like are really effective. And that's a huge shout out to our students and our staff. They're doing phenomenal work in all of our buildings. I'd probably end with this is I'll be the first to tell everybody that, you know, getting past October 1st, I thought was a huge milestone. I think another huge milestone is we're going to, here within the next 2 to 3 weeks, we're going to finish up winter activities. And I didn't think that might be possible, especially like with wrestling. I mean, heck, they're down at state wrestling as we speak. So I think that's a phenomenal thing. So we head into spring here. And you know, we're hopeful that as we start to finish up the school year, which seems impossible, but it's coming right around the corner, of continuing some of the activities for our kids that are a lot of fun. We've made our announcements, like with prom, for example, that we're going to have something. It may need to look a little different when we get there, but it is our intention, unless things, you know, go real crazy, to have something. So that, and graduation and those type of things. So it's kind of fun to start having those conversations. So, but as always, if you ever have questions, please reach out to me. Thank you.
Lisa,
Yes.
Margaret Brink here. I just want to take this little moment to thank the great leadership that I've witnessed just through these calls from the schools and from the hospital and from the city, because Four Corners as a health department really has good partners. And so the leadership that we've witnessed in this community and the cooperation has been phenomenal. And I thank all of you for working together and having that cooperative work. Otherwise, it doesn't work in cities. So kudos to York, Nebraska. Thank you.
Thank you, Margaret. I agree. There's a lot of great leaders throughout the county, and it's what's making us get through. It's making it much easier to get through this. Oops. Okay. I am not seeing Brad on the call. Do we have anyone else from the K through 12 schools on the phone or on the Zoom? Okay. If you're there, go ahead and jump on in. Otherwise, your college they messaged me, they're on. So if you have questions for them, feel free to type them in. They don't have an update today though. Southeast Community College is continuing with their online classes at this point in time. You can go look up to see what's being offered through the York Regional Campus on their website. And we'll move on to the faith and community nonprofits. Do we have anyone on from that sector? Jake, do you want to talk about Friday's meeting?
Hi, yeah, absolutely. Sorry, let me get my lighting right here. Good morning, York. Thank you, Lisa. Yeah, first of all, here at the York County Health Coalition, we have seen a pretty sharp increase in the last couple of weeks for requests for financial assistance, which tells us that people are getting word out. So we want to thank everybody for that very much. We greatly appreciate it. We had a decrease in January. We always hope that's a good sign, but we always want to double check. So thank you to everyone who's made referrals for us, who's gotten word out. And I do want to make sure everyone's aware there are still COVID funds. We are doing our best to use it up, but don't let that stop you. If you have anyone or anything you need, please put them in touch with us or give us a call. Our Facebook has the number for that. I can get it here if anyone wants it in a little bit. Tomorrow, we are going to be hosting our annual meeting virtually here through Zoom and through Facebook Live. If you do not already have an invite, then I would recommend use the Facebook Live. We're trying to tighten up our web security after an incident a couple of months ago. But we also are happy to share that if anyone is interested in getting the actual Zoom invite. You can reach out to us through Facebook, through our phone numbers. We're going to be talking about a lot of different volunteer opportunities, a lot of different things that we're planning to do in the coming year for the community. One of our primary goals is to provide a lot of really concrete things that we are participating in or spearheading that people can join in on. So that's 11 to 1 tomorrow virtually, and all are welcome, all are needed, and we want to make sure that we're providing opportunities for people to give back to the community. A URL can be provided, Kevin's iPad. Give me just a moment when I finish talking here and I'll post that in the chat for our website. Yeah, if there are any other questions, please feel free to reach out. Otherwise, thank you everyone for making this a great community and a safe community. It's been good to see the response work. Thank you.
Thank you, Jake. And I will just add on to Jake's comments about the meeting tomorrow. You know, YCDC is involved within the Health Coalition because what they do is truly affecting our workforce, our housing ability. So we really are trying to reach out to the greater business community, the greater education community, The name of the organization is York County Health Coalition, but look at health as full circle. Full circle, being able to do what you need to do, being healthy mentally, emotionally, financially. So if you can join that meeting tomorrow, we would love to expand on that. Jake, I hope you don't mind me doing an extra plug for you. I will move on to the business reports. I have two things at the top. One, next Wednesday, we are doing a Connecting for Leaders Masterclass. We are bringing in Ginger Johnson virtually to, she's an author and a speaker from the Oregon area, to give you the skills on to connect with yourself, connect with your team, if you're in a management role, to connect with your goals, give you the skills and the tools to move forward, and also to connect with the community in 2021. She's a very powerful speaker. The registration's on our website. We would love to have you. We would love to have you on there. And then Kevin, to answer your question, the Health Coalition meeting tomorrow is from 11 to 1. And feel free to eat while you're on. And then we should be mailing our invitations today, but you can treat this as a save the date. We are moving forward with a in-person annual meeting this year. It's our 25th anniversary, which we're pretty excited about. So save the date for March 18th. We would love to have you there. It'll be in the evening, social starting at 5:30 and dinner and program at 6. And I know Madonna is busy with the home show, but Rhonda is on to provide an update.
Thanks, Lisa. Just a quick update from the Chamber. The York Chamber of Commerce's Home and Garden Show is tomorrow and Saturday. We are very excited to have this event return and taking precautions to keep the pandemic in mind. So we will have one entrance for everybody to come into. We will be doing temperature checks and giving each person that enters a wristband, and then asking you to exit through one door so that the traffic flow kind of stays in the same direction. Masks are obviously required. We'll have sanitizer stations, and the facility staff will be there on hand as well, making sure we follow all protocols and procedures. So we invite you out. I know the vendors are very excited for this opportunity to return and meet and greet with all of you. Thanks.
Thank you very much, Rhonda. Does anyone else have anything they want to share this morning before we wrap the meeting up? Any questions you have? I love the questions today. Good job. Okay, I'm not seeing anything pop up on Facebook, and I'm not seeing anything pop up on chat. So we will go ahead and wrap this meeting up. We'll have another one 2 weeks from today. Same Zoom link, plus they're always live on Facebook. So feel free to reach out to any of us with questions in the meantime, and have a great weekend.